Hello, my dear students. I am Dr. Vishnupriya, Associate Professor at St. John's Medical College Hospital, Bangalore. My channel is about basics OBG. I'll be discussing various basic topics in obstetrics and gynecology in various episodes. And today's my topic is on combined screening. So, what is combined screening? The various components of the combined screening. What is the gestation that which we do, and how to interpret the report. These are the various topics which I would like to cover today. Now we will discuss about the combined screening. When do we do with the combined screening, and what are the various components of the combined screening, at what gestation we do, and what are the various indications in which patients or in which mothers we prefer to do, and how do we interpret the result. So these are the various headings that we will discuss the combined screening. So when I say the components, it mainly includes the NT scan and the double marker. What is this NT scan? NT scan is done again between 11 plus 6 and 13 plus 6 weeks. What is NT here? It is a nuchal translucency. It is the skin fold thickness or the subcutaneous tissue between the skin and the soft tissue behind the neck. So nuchal translucency, usually the normal is till 2.5 millimeters. Any value equal to or more than 2.5 millimeter says that it is abnormal value. When we add this nuchal translucency scan to the double marker, we call it as a combined screening, wherein we even include maternal age and the ethnicity and any medical disorders. All this combined put together is called a combined screening. What is it done for? We usually do to screen the chromosomal aneuploidies, which is most common being trisomy 21, Down syndrome, and the other trisomies like Edwards and Patau's, that is trisomy 18 and 13. So when I say what double marker, what is the double marker? Double marker includes two components, that is beta HCG and PAPP. These are the two analytes that we check in the blood, that is serum. So in chromosomal aneuploidies, the research or the evidence says, so that these values vary, and entire result, that is combined screening result, will give you an idea whether the baby is having the Down syndrome or not. So what is the sensitivity? Sensitivity is almost 90% to 92% with a false positivity rate of 5%. So now we will go to the indications. What are the indications in which we prefer to do? Most commonly, we do in the mothers with the age more than the 35 years, where there is more prone for or risk for having the chromosomal aneuploidies. Second, in the past history, if the previous babies has any Down syndrome. So in this situation also, in the present pregnancy, we prefer to do this. Third, family history of Downs. These are the various reasons with which we would like to do the double marker or the combined screening. Then coming to the interpretation. So as I said, the combined screening result is the computer generated result, which comes as the risk stratification into, it could be either low risk result, or it is an intermediate risk result, or it is a high risk. When it is low risk, this category of women will go to the routine antenatal care, wherein further evaluation is not required. That is, it is less than 1 in 250. So the risk is as equal to the general population. So you have done a test and the risk is low risk. So they are grouped or joined to the general obstetric population. But when the risk comes as intermediate risk, then we need to subject them to the non-invasive prenatal testing. So what is this? It is self-explanatory, where non-invasive means we are taking the blood, that is we are drawing the blood or maternal serum, and we are checking for cell-free fetal DNA. It is done around 10 weeks. But as you can see, the combined screening is done between 11 to 14 weeks. So whenever the result comes as the intermediate risk, this NIPT can be done after 14 weeks. Once you get the result and the result says it is intermediate risk, we need to subject the mother to the CFF DNA, that is NIPT. Generally, we call it as an NIPT. This result can come as a positive only after 10 weeks because the fetal DNA enters the maternal blood, it's only after 10 weeks. So, there is no point in doing before 10 weeks. So, remember children, NIPT is always done after 10 weeks, and once the risk of the combined screening comes as an intermediate, then only we are going to do the NIPT. Then the group of mothers whose result is high risk, we need to confirm that is more than 1 in 250. It's very high risk. So whether this particular baby is having the Down syndrome or Edward or Petau, we need to confirm. Such higher the risk is. So what are these tests? These are called diagnostic tests. So you are going to diagnose this particular pregnancy being high risk in screening, whether this baby carries is harboring Down syndrome or not. How do you confirm? These are called diagnostic tests. It could be amniocentesis or it could be CVS. So wherein it is invasive. So it is done in the fetal medicine center, wherein the needle has to be passed through either through the transabdominal route or transcervical route, and the fetal tissue, that is either placental trophoblastic tissue cells, usually it is cells, or it is amniotic fluid, is withdrawn and should be checked for the chromosomal aneuploidies. So in this class we have learnt about what is combined screening, what are the various components, at what gestation we do, what are the various indications, how to interpret the result. Once you interpret, how to follow up the mothers with the further pregnancy checkups. Hope you understood. We'll meet in the next video. Thank you for hearing.